This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM listeners, we're excited to announce our upcoming event, Palliative, a community educational event exploring the nuance of pediatric palliative care on June 27th at 6:30 p.m. in the Anschutz Health Sciences Building. We will be screening the Emmy-nominated short film, Palliative, featuring Dr. Nadia Tremonti's work providing end-of-life care and easing the suffering of her patients and their families at Children's Hospital of Michigan. The film will be followed by a keynote address by Dr. Tremonti and a panel discussion with experts from Colorado's pediatric palliative care teams. Tickets are $30 and all proceeds will be donated to the Denver Hospice's Footprints program, the Princess and Superhero Party hosted by Children's Hospital of Michigan, and Emergency Medical Minute. There will be food and drinks served prior to the screening and during a brief intermission. Come join us for a thought-provoking evening with the community for our first event since the pandemic. Check out the link in our show notes to buy tickets. Thank you.
All right, well, good evening, everybody. So this is a kind of in the series of do opiates work better than over-the-counter pain medicines, medical minutes. So there's been several studies in different venues that compared things like oxycodone or hydrocodone to NSAIDs or Tylenol. And this is another study. This was done in pediatric patients who had fractures, seen in an emergency department, and they had their fractures managed, splinted or casted, and then were discharged with either ibuprofen or oxycodone. And they had about 400 kids, and they followed them to see how their pain scores were over a 6 weeks period, and then also see what kind of side effects and kind of return to activity. And oxycodone and ibuprofen had basically equivalent pain management. There was no difference in the pain scores. And then the side effects were much more in the oxycodone, as you'd probably expect. And then return to activity was actually quicker in just the ibuprofen group. So overall, there was not any particular benefit to oxycodone in terms of pain control, and ibuprofen did better in terms of side effects and return to activity. So kind of another study that shows that, opiates probably aren't great for most conditions. So, if we're seeing kids and, parents are concerned that the ibuprofen's not gonna be enough for their pain, we could say that it does just as well as the pain medicines and they have less side effects and they get back to their regular stuff better. So any questions or comments? All right, thanks guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.